You know, what we do to our bodies when we're young has a whole lot to do with what happens as we grow older. And today we're taking your phone calls. We're talking about osteoporosis with our medical expert, Dr. Charles Roman. Thank you so much for being with us.
Thank you for having me.
Now, the number to call is 706-569-9390. And Dr. Roman, they're on the phone already. So we'll go to Becky. Okay?
Great.
Becky, what is your question for Dr. Roman?
Well, my mama has osteoporosis, so I was curious if it's hereditary and if I'm at risk.
Well, that's a great question, Becky, and the answer is yes. Osteoporosis does run in families. So if you have a mother who has it, you are very much more likely to develop it yourself in later years.
Wow. So what would you suggest to her as far as trying to prevent it if she can?
Well, good question. To prevent osteoporosis, basically what you're going to try to do is eat a diet that's rich in calcium and vitamin D, get lots of exercise, and avoid things like excessive alcohol and smoking.
Now, one of the major points about osteoporosis is that millions of Americans are walking around with it, and millions of Americans don't even know they have it.
That's right. As it turns out, about 50% of the women over age 50 are going to have some kind of osteoporotic fracture in their lifetime.
50%, Dr. Roman?
Over 50%.
Oh, my goodness.
And it gets even worse. 70% of the women that have it walking around out there don't even know it. And then finally, about 80% of the women that know it don't get treated for it.
So are they generally finding out about it because something happened?
Correct. In other words, years ago, we used to think grandmother fell down the stairs and broke her hip. What we now know is that grandmother had osteoporosis in her hip, the hip broke, and then she fell down the steps.
Ooh, oh my goodness. Oh my goodness. Now, was that because grandma didn't eat a balanced meal? Did grandma inherit that, or was it part of all of the above?
Well, osteoporosis develops in women, for the most part, in women over the age of 50. And as women get older, bone turnover starts to increase, and bones tend to get thinner and thinner. And unless you do something to try to prevent that or slow it down, it just continues. And then one day you wake up and there's a fracture, and you go to the emergency room or the hospital and they go, wow, you have osteoporosis. This is what caused the fracture, and they had it for years and didn't know it.
We have another phone call. Matt, thank you so much for calling in to talk with Dr. Roman. What's your question?
I'd like to know a person that has diabetes, and if that person should get osteoporosis, how bad would that be for that person?
Oh my goodness.
Well, that's a great question. In general, people that have diabetes, regardless if they are over age 50, are going to have a greater risk factor in women, obviously, and also in men. Men, for example, get osteoporosis, and it tends to be associated with low testosterone levels. And diabetic males tend to have lower testosterone levels. So diabetic males will have more of a risk for osteoporosis than not. And again, a lot of it just depends on getting diagnosed early and getting treated appropriately.
And we started out by saying what you do when you're young. I was surprised to see that young children can get osteoporosis. What would bring that on in such an early age?
Well, fortunately, osteoporosis in children is rare, but it does happen. And typically it occurs either as a secondary osteoporosis, meaning that they have a primary medical condition that's causing the osteoporosis, or that they're on a medication that may be causing the osteoporosis. Primary osteoporosis in a child, there's a fancy medical term called idiopathic juvenile osteoporosis. Fortunately, it's very rare, and we really don't know what causes it for the most part.
What type of life would they lead? Can you help them to lead a normal life?
Well, if you diagnose osteoporosis early and you treat it early, yes, you can have a good life. So in children, for example, if they are osteoporotic, typically what you would do is you would treat the underlying condition to the extent that you could. For example, some children are on seizure medications. They have a primary seizure disorder. Some of the seizure medications can actually cause thinning of the bones or osteoporosis. And so you have to do a lot of things in conjunction with your primary care doctor and your specialist in order to have a well-rounded therapy in order to treat this.
We have about a minute left. Let's see if we can take this call from Lily from Columbus. Good afternoon.
Hello, how are you?
How are you? What's your question for Dr. Roman?
My question is that I had osteoporosis and I had hip surgery, but it still hurts. And now they want to do the knee surgery, so what do I do?
Well, those are great questions. You know, probably, if I understand what you're saying and asking, you actually have two processes. You have arthritis or osteoarthritis in your hips and in your knees, which is a degenerative process of the joints. And then you have osteoporosis, which typically has no symptoms, and that's the thing that's so deceptive. Osteoporosis does not carry any symptoms with it while the disease is advancing until there's a fracture. Once there's a break, that's when it's typically discovered. So in your particular case, the osteoarthritis you would need to treat just like you would osteoarthritis of any joint, pain medication and those kinds of things, even replacing the joint. Osteoporosis, you'd want to use medical therapy.
Wow. Thank you so much for being with us. It goes so fast, Dr. Roman, with the Roman Group in Columbus. If you have any more questions, we'll get them to him by going through the D. Armstrong Show Facebook page. We'll be right back talking about Bobby Badfingers. Is he a bag of chips and all that when we come back?